Today I'm talking with Dr. Richard Humle. He's going to share with us his experience in treating complex trauma and the ways he goes about supporting his clients using Schema Therapy and Mindfulness-integrated cognitive behaviour therapy. I'm sure you're going to enjoy this one.
Okay, life can be crazy. You're feeling like you're sinking, just trying to find a meaning. It's time for better thinking, yeah, better thinking. Time to tune in. Let's go.
Richard, it's great to have you here today for the Better Thinking podcast. Really pleased to be talking about trauma and complex trauma in particular. I think it's a very popular topic that a lot of people are interested to hear about. So, maybe we can hear a little bit about you first in terms of who you are, how you got into psychology, and then we'll kick off with the trauma conversation.
Thanks, Nesh. Thanks for inviting me on the podcast. It's very kind of you. I'm a clinical psychologist, so really my speciality is working with people that have, I like to say, emotional challenges, emotional and mental challenges. As clinicians, we'd call them disorders probably. So it's where clients are finding it very difficult to function, whether it's in their work environment, social environment, because of the emotional and mental distresses they experience. So really it's about me teaching those people specific skills so that they can take back control of their life. And I've been doing that now, it's nearly 14 years. So I went to university in Australia at USQ, University of Southern Queensland, and I got a professional doctorate in clinical psychology and started up my own practice for 3 or 4 years. And then my wife was having enough of her work, so we took a break for a year. And then I went and worked for the NHS. So I've had over a year's experience with NHS. That's the National Health provider in the UK, where I worked with adults that had chronic and enduring emotional experiences. So a lot of them were suffering. In fact, all of them had some form of complex trauma.
Yeah, fantastic.
So I got a lot of experience there with the complex trauma. And then I came back and worked in Victoria for a while, then worked in Fiji, and now you've given me this opportunity to work with the strategic psychology team.
Yeah, fantastic. And I think one of the amazing things that you bring to the table is your experience and the trauma work that you go out and do. Maybe you can tell a little bit about what constitutes trauma. How do we define it? What does that mean? It's a word that we throw around so much in psychology these days. How do we define that? How do we describe it?
So if we're talking about complex trauma, that definition is complex in itself. There's no real definition. If you look in the DMS-5, which is the book that provides us with all our diagnoses and all the ICD-10, there's no diagnosis or particular disorder called complex trauma. There is, however, trauma, as in post-traumatic stress disorder, which is PTSD. And I guess the distinct difference between the two is that usually with PTSD, it's a one-off event that's caused somebody specific distress. So they've had a very frightening emotional experience. They've either been in that very situation, for example, a car accident or something, or they've witnessed it. And so eventually what happens is they come up with specific symptoms that then we treat them with a diagnosis of post-traumatic stress disorder, PTSD. Now, that's very different to complex trauma. I guess the outstanding trigger or identity or way of identifying complex trauma is that it's an ongoing chronic, how can I put it? It's a chronic, ongoing event where you're involved in this constant trauma, ongoing trauma. And it usually starts as a child. So
it tries to describe a context. Is that what you mean in terms of the context in and of itself is traumatic,
yes,
being highly distressing?
Absolutely.
Okay, yeah.
It can be highly distressing, and I might get onto it later, but there are situations where there's neglect. So yes, it is distressing, although probably the child wouldn't be able to express that.
Sure.
But what I'm talking about here is sexual abuse, physical abuse, emotional and mental abuse. So it's usually from a significant other, so the family members or neighbors or teachers, for example. So that usually gives me a good indication that, okay, so we're dealing with here is complex trauma.
Can it be like neglect, where, a child is kind of left to their own devices where the parenting has been absent? So it's not something that's necessarily what we would go out and say, inflicted on the child like physical abuse,
Yes.
but rather it's the absence of something that would developmentally, we would encourage to be there.
So absolutely right. That's what I was going to touch on, was the neglect.
Okay.
So it's probably, it could be where the parents are maybe alcoholics or druggies. So they obviously, under the influence of alcohol or drugs, so they're not there to be able to provide certain core needs for the child. And so because those needs aren't being met, even though there might not be physical or emotional or sexual abuse, the child is still traumatized. And really because those core needs have not been met. It might be where, for example, parents, you'll have family situations where the father disappears for periods of time and comes back, and the same with the mother. So there's this sense of abandonment that occurs, and that for a child is very traumatic. So there's no stability, probably very little safety. Those are some of the core needs that a child needs. And because those core needs aren't being met, then there's this trauma that develops. Yeah.
It's interesting because most people, outside the sphere of psychology would look at trauma, like the medical term of trauma might be, something that's inflicted physical damage to the body. Trauma in psychology can be, someone, having, physical abuse or sexual abuse or, being put down or whatever it might be in its extreme sense. But at the same time, the instability in a family home where there might be absent caregivers, as an example, and not absent because they're working, so to speak. It's the emotional absence of providing love, nurturing, emotional stability, care, security. The lack of security could be an example of something induces that or forms part of the traumatic environment.
Absolutely. So you've got some of those core needs, which, as you mentioned, safety and stability, love and nurturance. So maybe the parents just aren't in a spot where they can provide that love and nurturance. Acceptance, accepting the child for who they are. Even guidance, not having any guidance. There's no boundaries set in the family. That in itself can cause problems. Although not perceived as trauma to start off with, it can develop into traumatic situations.
Yeah, absolutely. Maybe you can share with us a little bit about what that means for the child, at that time and obviously growing up, whether it's, into young adolescence, older adolescence, early adulthood.
Absolutely.
And ongoing.
So, there's a lot of brain development that occurs between the age of 1 and 6. And then another bout of brain development that occurs in the teenager years. So if those core needs aren't being met, then the child tries to in some way have those needs met. And so they develop these schemas or ways of coping that are functional as a child, but the problem is they become dysfunctional as an adult. So, for example, let's say there's an abusive father who always doesn't have anything positive to say to the child and runs them down, calls them names, and the child craves the father's attention. This is a basic core need, is attention. And also they crave praise. That's another core need for a child. So what happens is one day the child succeeds, say, at class, comes first in the class or does very well in a subject. And so he gets the father's praise. And as a result, he learns, if I achieve highly, Dad's going to praise me. He's going to pay me attention. And so what he does is he sets very high standards for himself. And it provides that need that he's desperately seeking for, that praise, attention, love and nurturance, which he only gets when he achieves at a very high standard. Unfortunately, when he carries that behavior over to an adult, that behavior now is strongly reinforced, and that, believe it or not, those core needs are still, there's that constant need to have those core needs met, even that they weren't initially met as a child. So the adult now starts to work at very high standards. He's, hardworking, perfectionist, working long hours, trying to maintain a family, trying to maintain a social life. And what happens is they burn out. So you get this situation where what was functional as a child now becomes dysfunctional, and it has dire consequences for the adult. And this is what I experience, people coming to see me. One of the issues is this burning out, not being able to keep up with life, finding that now they stuck in bed, literally, can't go to work. And when I go back further into the roots, I notice this is what's been happening. They've had this trauma as a child, these core needs weren't being met, and now it's starting to manifest itself in adulthood.
So formed in early childhood, in those formative years when there's brain development.
Yes.
And I'm assuming, and we don't necessarily have to go into it right now, but there's a complexity around, the release of, hormones and the like that occur when there's nurturing and security versus a different complexity of hormones and the like that are released when there is uncertainty.
Yes.
And potentially threat or more of a survival need to get through, and so there's patterns that are built there.
Yeah.
Some, as you say, might be, somewhat functional as a young person. I can go out and strive and work hard to, do well, and that might be, I can jump higher, I can run faster, I can, try and tidy up and get some praise. But that might not necessarily be functional later on in life if it becomes an unrelenting standard.
Absolutely.
Or if it can't be met because the people around you go out and provide the reward or the acknowledgement
Yes.
of that.
You'll find, though, the thing with, say, let's talk about unrelenting standards, is that kind of behavior or underlying schema is rewarded in society. So because it's rewarded, they continue to do it. But underlying the need, there's this sense of emptiness, this need that's, even though it's being provided at some level, it's never enough. It's never enough. It's constantly having to have this need provided, even when it is being provided at a certain level. So you've got that one dimension where the need is the perception that the need is just not enough, and then the other side of it where those type of behaviors get rewarded by society. So it continues to, increase the schemas which would develop because of certain needs that weren't being met, because of the trauma the child was feeling when those needs weren't met.
So schema is basically some thoughts or ideas, like rules that people live by that they've learnt some time ago.
Absolutely.
And when they take that into adulthood, it's they can become less adaptive than what they once were.
Yeah.
You in some sense gave us an example of someone who might be still quite functioning in the eyes of people around them. What would be an example of someone who has had trauma, complex trauma in their life that we would sort of see that are less functioning, that we would as a society kind of recognise?
So what I explained is probably the one end of the trauma, if you want to put it, trauma spectrum. So they obviously, with these people with unrelenting standards, they can get to a stage where they can't function. Okay, so they have the burnouts. But let's look at the other end, and that's for, let's say, for example, a child that's been sexually abused by their father. So they've had this constant abuse going on through their childhood and sometimes it get very frequent, weekly, daily sexual abuse. And one way, so in other words, there's no stability, there's no safety. So they don't feel safe at home. That core need of safety and stability hasn't been met. That core need of love and nurture hasn't been met either. So very powerful core needs that need to be met for a child to grow up and be functional. So with a child like this, they learn to, with my experiences, especially with young girls, is they learn to dissociate. So they will literally dissociate from the experience in the moment, from the abuse that's going on. And when they come to see me, they know something bad has happened, but they just can't remember exactly what it was. But the reason they come to see me is because they're not functioning in life. So they've learned to cope with the distress, for example, as they've got older, to go on to alcohol, drugs.
So as a young person, they dissociate to protect themselves.
Yes.
So they don't have to go out
distress.
and somewhat, in some sense, like experience that.
Yeah.
They switch off. And it switches off some of the memories of that too?
Absolutely. Well, it suppresses them. The memories are still there, because through treatment the memories can come back, but it's been suppressed into the unconscious awareness. So, but they have no actual recall unless they go through a specific treatment, and those memories come back. And it's their way of coping with the distress.
In that moment, yeah.
However, that doesn't help with getting the core need provided for. And one way they do that, at least the father does it, can be manipulative towards the child. So they say, look, if you do this, I'll take you somewhere, and they'll give them a hug and buy them an ice cream or do whatever. So in a sense, their core need is being met by actually agreeing to go through with the father's desires or wishes or whatever.
Very, very complex in terms of the complicated messaging for a young person.
Absolutely.
Because we're trying to put ourselves in the shoes of a young person and trying to appreciate how are they understanding this, and it's almost like, the hand that goes out and hugs you is the hand that goes out and smacks you.
Absolutely.
And not knowing which hand it's going to be. There's an ambivalence, that from an attachment perspective of connectedness and security. It's an ambivalent one,
Yes.
I imagine similar thing if there's an alcoholic in the home, as an example, that, just to make something up, it might be, quite, might be a common thing that they go into rage, anger, violence. You're kind of coming home as a young person and you're wondering, is mum or dad going to be drunk or intoxicated? Are they going to flog me today? Are they going to, or will it be okay because they're very loving and nurturing in this one little moment? I don't know what I'm going to get.
Absolutely.
So I don't know, so my hypervigilance is always going to be up.
Yes.
But I kind of don't know. And so when they do say, come here, and it's loving, there's that part of me that does want, because I crave that as a human being.
Absolutely.
Wow.
Yeah.
Very, very complex.
Yeah. And so that's quite common with alcoholics is, the kids will be home already and they know dad's been drinking. And when dad comes home and he's drinking, he's violent or aggressive in some way. So the kids are really in fight-flight mode. They're very distressed. They're hiding. Even mom would probably be trying to stay out of the way. So they know that, okay, dad's not going to be in a good spot when we go home, but that's that constant fear of safety and the instability about dad being drunk, even though some of those needs have been provided when dad's, sober.
What would be some of the things that we would expect to see, from young persons growing up that, are in that type of environment? So
what we notice is that we call these dysfunctional patterns that keep occurring. So, for example, if a father is sexually abusive towards their child, especially girls, is that they tend to then get drawn to the same men. So you'll find that they get into sexually abusive relationships or physically abusive relationships. Even though the intention is not to, they end up getting into these relationships.
How does that occur? What are your thoughts?
So it's about schemas. The child has developed certain schemas, and even though they're dysfunctional or unpleasant, they're familiar. So it's about familiarity. It's also about the fact that because the father has abused them so much, there's this deep sense from the child that they're worthless, that they're not lovable.
When you say familiar, my apologies, when you say familiar, are we talking about when something is familiar, it's also comfortable?
Yes.
In that, if someone's struggling with, alcohol abuse, but it's still familiar to them, so it's nice to feel that way, even though it's destructive.
It's not nice to feel that way, it's comfortable.
Comfortable,
it's something that they're used to. So even though it's dysfunctional, it's comfortable. It's what they're used to.
I
it's
know
familiar.
what to expect.
Yeah.
I know what it's like. I've lived in that space, and
Absolutely.
that familiarity has somehow an inbuilt comfort because it's familiar.
Yes. So that's one aspect to it. Okay. So it's that familiarity and that comfort with that familiarity, even though it's hard for us to imagine. How can you be comfortable
That
with
makes sense. And I certainly don't want to put this in the same context, but just trying to look at the functional perspective. It's almost like when someone keeps going to the same restaurant.
Yeah.
That it's got pretty lousy food. It was maybe good at the very, very beginning, but it's got some lousy food. But they just keep going back there because it's the familiar spots.
Absolutely.
It might not be functional anymore
Yeah.
in that it serves lousy food and it's got terrible service. But we go back there anyway just because, and we probably don't even think about it. We don't actually give a conscious thought and weigh this restaurant up against the other one. We just go, let's just go to good old, Joe's restaurant down the corner because that's where we've always been going.
And that's so true, Nesh, because I'll ask my client, and they would have gone through numerous relationships, and I'll say, what is familiar with all your relationships? And they've never thought about it. And suddenly they become aware, there was always sexual abuse or violence in the relationship. It was something that really wasn't in their awareness at the time.
Someone hasn't thought about the familiarity in terms of the
similarity in the people that they're attracted to. It's called, in Schema Therapy, we call that chemistry. There's a certain chemistry. There's a certain schemas lock with each other, and so you get this chemistry. And that's why...
That's a feeling.
Yes, it's like a feeling. I guess when if you first connect with somebody who becomes your sweetheart or whatever, and you get that chemistry, that's what I'm talking about. So people describe, I'll say, well, why were you attracted to that person in the first place? And it's always the chemistry. The chemistry felt good. It's this linking. I won't go too much into it, but it's linking of these schemas. Maybe that's for another podcast. But it's just the linking of these schemas. So yes, that's one aspect is why we get into these patterns is because of the familiarity.
So the chemistry is another word of almost saying familiarity. It's something I'm familiar with. It brought that.
Yes.
That known. It's a known quantity.
Absolutely. That's probably where it comes from. Is that the schemas linking together with the two people develops this chemistry. Yeah, I think that's what you're saying there.
Okay.
Yeah. So that's one aspect of it. The other aspect is because the child has been neglected in some way, in the case that we're talking about sexual abuse, there's this deep down sense that I'm unworthy, I'm not lovable, there's some kind of defect about me. So what happens is then they truly believe they don't deserve better. So even though they might be aware they're getting into these relationships where there's domestic violence, they truly believe they don't deserve better. So that's what they go for. They have such a need to be accepted, to have love and nurturance, that the need overrides the rational part of, this is an unhealthy relationship, I shouldn't be here. But really at the core, they don't believe they deserve better. So that's another reason why they get into these patterns.
And the belief, I don't deserve better, when someone knows that belief, they enact that belief. It's I don't deserve this, so I won't take it. So I'm assuming in that sense where we're kind of saying if someone were to find a better option available, whatever that deserving might be, if it's available but they can't see, they won't be able to see that they deserve it because they'll only see what they deserve and therefore keep going back to what's familiar.
Yes.
So there could be opportunities that people are missing.
Absolutely. Or what will happen is they will meet some younger, a man, for example, who's very thoughtful, empathetic, kind, generous, got all those qualities about him, but there's no chemistry. Okay, there's no familiarity. So they actually get the woman who's been subject to abuse as a child will be put off by that experience.
What would they be feeling? Is it like a scenario of, if you loved me, you would get upset if I'm going out with my friends? You'd be jealous of me, or you'd be jealous. Like, how does that actually play out?
In relation to their peers, or in relation to
in terms of how they go out and keep selecting someone who's familiar, so assuming there's three people who are taking interest in the person who's had trauma in their life. One's most familiar to them in terms of whatever backgrounds occur, and two come from a different space.
Yes.
Right? How does that play out in a social sense if, let's say, someone who's going to be, kind, thoughtful, compassionate, approaches the person with trauma, and obviously they're making lots of assumptions here, but how would they kind of reject that person, or would they kind of find reasons not to go out and connect, or they just don't feel the chemistry's there?
They just don't feel the chemistry. That's my experience by speaking to the clients, is there was no chemistry. It felt weird. He was strange. It's like there's a wall there. Even though this particular person is going to provide all the needs that this woman's seeking, there's this wall. It's like it's not familiar, probably, going down those lines again. That's the way they describe it to me. It was just, there was no chemistry. Sure. That's really what my clients would be saying. There's no chemistry. And there's no awareness as to why there's no chemistry, or to why they prefer this man that's going to perpetrate that domestic violence. That only occurs when they come into treatment, and suddenly through treatment they become aware, And even so, what happens, what I've noticed, is they will persist with a relationship even though there's no chemistry or there's no initial feeling. Or even when, the thing with these clients as well is they crave love and attention. They crave safety and stability. But when you offer it to them, they want to go away from it. It's interesting. It becomes, in a sense, offish. They feel offish about it. So they've got this constant craving for this love and attention and nurturance, but when they're given it, then they move away. So you'll notice they'll break the relationship. So initially they might be interested in the man, but as soon as he starts to attach to the lady and starts to be more empathetic, kind and loving,
kind of doesn't fit. Is it? And I keep trying to put things in analogies because that's how my head works. But when we say like how it fits, is it almost like when and please appreciate this, not trivializing, but I might go and see a jacket and I go, that looks like it's a real nice jacket and I'd love to go and wear that jacket, but I put it on, and as I'm slipping on even the first sleeve, I don't feel right. I don't feel like it just doesn't feel like it's the one. Visually it did, but now that I'm putting it on, it doesn't feel right. Now what's interesting is I can't even cognitively go out and say why it doesn't feel right. It's a visceral thing that I'm experiencing. No different to, I imagine, if I put lipstick on my, on my lips rather than lip gloss.
Yes.
Right. So so my lips aren't chapped. If I were to put lipstick, I would feel like that feels really viscerally. It doesn't connect with how I would be. Yeah. Is it that sort of thing where there's this visceral thing that in life, and I'm assuming this happens not only with trauma. This is the way of a human being being in the world. Yep. Just depending on the references we have, we're not necessarily even describing only people with trauma. We're describing human beings, how the past has, obviously, the focus today is trauma, but how the past shapes how we are in this world and what we feel.
That's right. So I go back to schemas, okay? So if we were to go into schema therapy, there's about 18 different schemas that develop, and a lot of them have to do with certain needs not being met. And so what happens as adulthood is when you meet certain people and they behave in certain ways, those schemas get triggered. Okay, so a schema is made up of the way we interpret life in a certain way. So how we've interpreted life as we've developed from a child through an adolescent to an adult.
And interpretation meaning what our history tells us about what the world is.
Absolutely.
It's the lens in which I view the world.
So I'll give you an example. One of those schemas is called a defectiveness schema. It doesn't mean you're defective, by the way. It's just a name for the schema. But it develops because of the way your parents interacted with you, for example. So if you had a father who was abusive towards you and called you names, he was continuously running you down. So then you develop this belief or the schema that in some way I'm invalid, I'm defective. Okay.
That's fascinating.
And so you take that through with you to adulthood. But how do you know when a schema has been triggered? This is where the visceral part comes in. A schema, when a schema gets triggered, you know because of the thoughts and body sensations you experience. Okay. And they can be quite intense. So when a schema gets triggered, you can be going along with very comfortable, say 0 out of 10 for anger or something, and then something happens very quickly. Somebody says something, which normally wouldn't make somebody angry, but suddenly, wham, you're at 10, you're enraged. And what's happened there is the schema has been triggered. Underlying those thoughts about what that person said is a deeper underlying belief that in some way I'm invalid, I'm not good enough. And so by what that person has said, even though they didn't mean it or in trying to imply that, you've interpreted it as he's just meaning I'm not good enough, I'm unlovable.
Yeah, and so, that's how you make your connections.
Yes.
You read into those things and then you decide whether I'm going to pursue this relationship
Absolutely.
or not.
Absolutely. So another probably one that works with relationships is what we call the abandonment schema. Okay, so maybe during childhood the parents left the child, one or both parents left, whether that was through death or just for other circumstances. And so the child develops this sense of abandonment and that they're going to be lonely for the rest of their life. Okay, this chronic feeling of loneliness. And so they come across this man that they develop an interest because even though he's a perpetrator, he's filling that little gap of saying, look, I'll be here for you, I'll always be here to help you. And so his schemas link with this woman's schema of abandonment. And so that chemistry is developed because now that woman feels that need in some way. She's not consciously thinking of this, by the way, but that need has been met temporarily. And so that's why you find they stay with the same partner for a long period of time, even though they've been violated in some way domestically. The partner will always come back the next couple of days and say, I love you, I'll never do it again. And so again, they're filling that, they're linking with that schema or that abandonment schema. Yeah,
schemas are absolutely wild, and I'll just share something that came to mind while you were talking. I actually went to a workshop recently, and in doing some role play, something came to mind for me, and it was really about the conversation was about self-care. How do you go out and look after yourself, and be self-compassionate? And we're talking about our values, and I kind of in domains that are important to us, and I kind of thought about my children, my wife, my family, is a big one for me. And I almost fumbled onto a schema of mine, unknowingly, that effectively goes out and says, for me to be a great father and to be a great husband and to fulfill that role, to be the best of those, I must sacrifice myself.
Yes.
Right? Which is kind of crazy thinking about it in that way. The schema says I must go out and somehow lose in this equation, right?
Yes.
And when I was thinking about what happens if I don't lose in this equation, it feels horrible. Yep. Even talking to you right now, I feel kind of almost like a disgust or a pressure in my solar plexus.
Yes.
Here. That doesn't resonate, doesn't fit. So it's my wife might say, "Go get some new sneakers. Look at them; they're all shabby." And in my mind, it's like, but we could use those resources for our children.
Absolutely.
And in actual fact, it has to happen that way because that's how I am. That's how I'm a man. Yeah. So don't take my crummy shoes away. because that's taken my giving, my love, my everything away. And so, there's this kind of conflict that doesn't serve me anymore. And I know that I if I think about my parents, they've ultimately given the world, the sacrifice of everything. I can feel it sort of welling up how important that is. That's my schema coming up.
Yeah.
And so
very powerful.
And I continue to see how much they give up. See, this is so entrenched. For me to put me as being a good person, or to be the highest of the high, requires me to sacrifice. So it's kind of like, if I want to be a good person, I must sacrifice. And you and I clearly know that's not the case. But this isn't a logical argument I'm having. This is a visceral, emotional fight I'm having in terms of, how do I have both those things, that I can be a good man, I can be a good husband, I can be a good, parent, and be nice to myself. It's kind of like, why can't that happen? It's like, my body is uncomfortable. I'm not familiar with that feeling.
Absolutely. That familiar of being able to receive. So what you're talking about there is what we call self-sacrifice. You sacrifice your own needs for everybody else's. And that's quite common in our industry, by the way, health industry, where we're always putting other people before ourselves. And that can be a very powerful schema, as you've observed, because when those schemas get triggered, the sensations, we know, for example, I know I'm anxious because I can feel my heart beating. I can feel butterflies in my stomach. I can feel my hands shaking. These are body sensations, and these body sensations can be very unpleasant.
It was like there was a snake in the room, and it was like full fight or flight.
Absolutely.
I'm terror.
Yep.
Terror to have self-love.
Yep.
It's crazy stuff.
At a rational level, it sounds crazy, but when you get to the emotional level, it's very, very difficult to overcome and to, I guess, accept at that deeper emotional psyche level. And that's where a lot of the work has to be done, especially with these clients that have been traumatized.
Yeah, I suppose that's a bit of a segue. How do we work with, clients in that space, in terms of, whether it be, I wouldn't say there's been trauma in my life, but that familiarity is there, that there's those schemas are alive and well in all of us.
Absolutely.
How do we go out and make our way through that? Is it a matter of identifying it? Is it knowing what we're dealing with? What do we do?
Yeah. Well, firstly, I just want to put a point here, is that we all have schemas, okay? Different amount. Doesn't mean that we're traumatized.
No.
We haven't experienced trauma as a child. And I've really just focused on one particular type of complex trauma, and that's with childhood, okay? Just to go quickly before I answer your question, is that there is adult complex trauma. And that usually has a lot to do with our war veterans going into war and having this continuous, being under attack, etc. And also refugees. The life they've gone through in their own country, and then coming here and continue with that trauma because of the sense of isolation. So there's that childhood trauma, and then there's adult and childhood trauma, which is what I've talked a little about as being children being traumatized as in their childhood, and then, so let's say sexually, and then going into adulthood and continually being sexually abused by getting into these repetitive dysfunctional relationships. So I just thought I'd make that clear.
No, absolutely, very good point, because the trauma is not necessarily synonymous with schemas are not synonymous with trauma.
That's right.
They're across the board. Yeah. That's how we need a framework to go out and see life through.
Yeah.
Trauma is an added layer of the context that's there. It's not. I haven't experienced trauma, not by any means, but similar mechanisms are in play underneath.
Yes, absolutely, and so that can help treatment in a way. So, complex trauma, like I said, there's no official diagnosis of it. And because it's so complex to diagnose, because it can manifest in many different ways, from chronic anxiety, reoccurring depression, through to personality disorders, especially borderline personality disorders, to dissociative disorders. Really, it can be a complex of diagnoses. What's the key really is finding out the history of the client. So, what was their childhood like? Or what's happened in the recent years that you're presenting with these specific symptoms?
So trying to really, in a detailed level, try and understand how this person's formed that viewpoint or what they've gone through, what that visceral response must be like.
Yes, so how have they ended up in this situation that they've come to see me? The challenges that they're having, why are they here? So in other words, going back into the history, and that's you, because when they first arrive, I probably don't know that they got complex trauma. I just know that suffering from chronic anxiety and that there's recurrent depression.
Sure, you might not even find out for many sessions to come unless they are willing to feel safe enough to
Absolutely.
Yeah.
So it depends how safe the client feels. So if there's a client who has a strong schema, abusive, what we call abusive trust schema. So they find it very difficult to trust people. I mean, if you can't trust your parents, who can you trust? So coming to see a stranger like myself takes a lot of courage, especially for the people who are suffering like that. So it can take many sessions till they get to a stage where they can open up about that abuse. And then, it's easier to join the dots. So then I start thinking, okay, this is complex trauma. So how do you treat it? Getting back to your question, and in the same light, there's no specific treatment for complex trauma. Okay, there's a lot of ideas and theories out there, but there's no real set. Okay, this is a treatment for complex trauma. There's gold standards for PTSD, post-traumatic stress disorder, which work very effectively. But for complex trauma itself, those same treatments, in my experience, aren't really as effective as using other treatments. And personally myself, I've worked with a lot of complex trauma clients, and I use a combination of mindfulness-integrated cognitive behavioral therapy and schema therapy. So one of the things you'll find with clients that have complex trauma is they dysregulate. And what I mean by that is they don't have the ability to regulate their own emotions. So they'll cope by, drug abuse, alcohol abuse, strong avoidance strategies. Avoiding anything that's distressing because they just don't have the skills and the ability to regulate themselves.
When we say regulate in terms of
emotional regulation,
to try and stop those feelings of feeling upset, feeling hurt, feeling some sort of, assault occurring, towards them, whether it be disapproval or abandonment, they will do something to try and get away from that, whether it's dissociate or whether it's to drink a lot or whether it's to, cause drama even. Could that be a distraction in terms of disagreements in their life to, pick a fight, so to speak?
Because it distracts from the painful distress that they experience. That ongoing sense of fear or that ongoing low mood, especially with low mood depression, which is very common in these clients, is they can never get away from it. It's constantly there in their life. And it's just overwhelming and overbearing. So, to some clients will literally self-harm. They'll cut themselves so that the pain, the physical pain, distracts from the emotional pain. The physical pain is a lot easier to bear than the emotional pain. And you've got to imagine that these clients are experiencing this 24/7. So they are desperate. So they'll do whatever they can to try and escape this experience. And they do that, self-harming in many different ways, overeating, binging, alcohol, illicit drugs,
Is this why it can go so unnoticed? That
absolutely.
someone can be going out and just living what looks like on the outside a very functional sort of life, but what they're doing is coping in a whole lot of different ways that aren't necessarily, helpful. They might look, quite functional on the outside, but on the inside they're very miserable.
Absolutely. And more so in our era today, where alcohol and drug abuse is more acceptable, if I can say that. I see a lot of people who have got complex trauma, and they deal with it by binge drinking or drinking regularly with their mates who reward them for doing that. There's that social interaction. You, my mate, they want to see you the next day. You're back in the bar again. You're taking drugs. So that reinforces that coping mechanism. So unfortunately, but it's dysfunctional in itself, because it causes, all you're doing is suppressing the problems which come back until they're dealt with.
And treatment would therefore look at that. Are we removing the suppression? Is that in terms of giving alternate activities to do, or broadening that, or how do we sit with those emotions better? How would you tackle it?
So the way I tackle it is, you've got to realize that the alcohol drinking and the drugs, that's the way of coping. You can't expect to tell the client, okay, stop doing that, but not give them another way to cope, okay? Because they're going to have to find some way of releasing that distress. And then they'll just find another dysfunctional way of finding. So you need to teach them new skills to be able to cope. And at the same time, gradually get them to stop the coping strategies they have. Obviously, if the alcohol and the drugs is getting in the way of treatment, then we've probably got to focus on the triggers that are causing that and try and get them to a level where they can function in therapy. Okay, I'm talking about illicit drugs and alcohol. So the way I go about it is first of all, I teach them emotional regulation, really. I'm teaching them, giving them skills through MICBT, mindfulness skills, so that they can start learning to regulate their emotions. That's the first thing they need to do, is to take control of their emotions.
MICBT meaning Mindfulness-integrated cognitive behavioural therapy, MICBT, rather than just CBT, which is very commonly known.
Yeah. So with MICBT, we're not interested in the content of the thought. So we don't specifically look at what you're thinking and what's the underlying meaning. What we're interested in is how your mind is processing information and how we can change the way that mind processes information. Okay, so what tends to happen is these clients are having very, very powerful thoughts that have very strong underlying meanings, which are usually linked to schemas. So these thoughts are very powerful. So you can imagine when we have no control over what thoughts come into our awareness, but we do have a choice as to whether we let that thought go or hold on to it. And so what's happened unconsciously is these particular people have trained their mind to hold on to these thoughts. And it's like a magnet. Those thoughts are like a magnet for the mind. And the longer that mind holds on to the thought, the more powerful that thought becomes. So, if you ask a client who worries a lot, you notice when you got up this morning, you started to worry about what was going to happen at work. What happened then? And then they'll tell you, well, I started to think of this and that could happen to work. And all of a sudden, you've got all these thoughts that are in your mind. And with some clients, it just becomes so disorientating because there's so many thoughts and your head feels like it's going to explode.
It's overwhelming. It engulfs you.
Absolutely. And that's because the mind's holding onto the thought. So it's kind of like putting a battery charger onto a battery. The longer you put the battery charger onto the battery, the more the power builds up. There's obviously a limit, as there is in your mind. There's a limit to how much you can take until you have to do something desperate to be able to get those thoughts out of your head. So this is what the mind's doing with these clients, is it's holding onto those thoughts very powerfully. And as a consequence, you experience emotion. So because of the thoughts you're having, with that underlying meaning, you experience an emotion, let's say fear. Okay? And that the power of the thought, or the power behind the meaning of that thought, correlates or runs in parallel with the power of the emotion. So the stronger the thought, the more powerful the meaning behind the thought, the more powerful the emotion. Schemas have very, very a lot of power. So you'll notice that when the schema gets triggered, as you were aware just now, earlier on, that those sensations or that emotion can be quite intense. And then so how do we know we're anxious? Well, as we explained earlier on, you might feel some pulping in your heart, palpitations in your heart. heaviness or lightness in the stomach, sweaty palms. These are body sensations. Okay, and so what's happening is they're unpleasant body sensations. And so we react to these body sensations because they're unpleasant in a way that we want to avoid them. So our tendency as humans is to want to avoid body sensations.
Unpleasant ones.
Unpleasant ones. Thank you. So unpleasant ones. And so we get into certain behaviors, for example, going to drink alcohol or illicit drugs, and that behavior gets reinforced because guess what? The unpleasant body sensations disappear and they usually get replaced by pleasant ones. So that behavior is reinforced. But also what's going on here is we've unconsciously trained our mind to perceive body sensations as bad, terrible, this is no good, especially unpleasant body sensations. So as soon as the mind is aware that we're experiencing an unpleasant body sensation, be that anxiety, anger, depression, fear, frustration, our mind reacts to it. It gets us into this fight-flight mode. So our amygdala gets fired up and we get ready to fight or flight. So it reacts to the body sensation and as it perceives it as dangerous, and then we react by trying to avoid it. The thing that's going on here, though, is that as we react to the body sensation, we're actually feeding it. So the more you react to it, it's like food. The body sensation gets stronger because you react to it. Just in the same way that you react to the thought. We react to the thought by thinking the thought. And then all these stories start to evolve. So in a sense, when the mind reacts to the thought by thinking the thought, it's feeding it. So it gets stronger and stronger.
When you say react, are you talking about when you engage with that thought?
Absolutely.
In terms of the content of the thought. So if two colleagues go out the door at work and the thought pops up which says, well, they didn't invite me, I'm not part of their group, they don't like me. If I react to it, I buy into that,
Yes.
and in an effort to get away from that, when they come back, I might go out and go, well, how come you didn't invite me? And that could cause obviously, some difficulties in the space versus a situation where I might have those thoughts and go, they didn't invite me, they mustn't like me. And then being able to kind of, from a mindful perspective, go out and pull the handbrake on, so to speak, and go, oh, wait a second, there could be other explanations to this. Maybe they already had something pre-planned, or maybe I was on the phone when they decided to go. Yes. Maybe they didn't even see me sort of coming in, or
absolutely,
there's alternate viewpoints rather than the one viewpoint of abandonment.
That's absolutely right. And so following on from that, our thoughts are a distortion of reality. Okay, we interpret our thoughts on previous past experiences. So that's another reason why we get distressed, is because our mind reads a thought as being real, okay, as being reality. You can imagine the amygdala responds to the thought as if it's reality. So what we're training the mind to do then is to accept the thought for what it is, just a thought. And therefore it learns that a thought is just a thought, let it go. In the same way, the mind learns that a body sensation is just a body sensation. It's not going to jump out and kill you. It's not going to hurt you anyway. It's just a body sensation, that's all. And so the mind learns to let the body sensation be. In other words, you stop reacting to body sensations, you stop reacting to thoughts. And what happens is you become less reactive. So you develop what we call equanimity. You become more content, more relaxed. And even though you will still experience the rainbow of emotions, in other words, anxiety, depression, so you're not getting rid of emotions, you certainly don't want to do that.
You can't.
That's right.
Yeah.
Unless you went for some kind of operation in your brain, it's not going to happen, or dissociate to them. What happens is that even though you experience the emotion, your mind has learned unconsciously not to react to it. So there's no need to go for a drink. There's no need to, go for illicit drugs or whatever. There's no need for avoidance. It's just the awareness that the sensation is there, and then you let it go. The awareness that there's a thought there, and the thought, let it pass through. So your mind learns to let thoughts go, and your mind learns to just let body sensations be. And as a result, you start to regulate your own emotions.
So you're cultivating a position of being able to notice the thoughts, not buying into them.
Awareness to the thoughts.
Awareness to the thoughts. And then allowing them to pass rather than grabbing onto what
Absolutely.
they're saying. You know, those people are abandoning me.
Yes.
Rather than grabbing onto that, recognizing it as a thought.
That's right.
And
that's all happening unconsciously, by the way. Yeah.
Yeah. Because that's your lens of the world that, you know, occurred through the circumstances you were in before.
Yes.
You know? It's fascinating to look at it that way, because that also goes out and says a lot about responsibility. That we
Absolutely.
are not responsible.
That's right.
For having those thoughts. We are not responsible for our history. We've lived the history.
Yes.
But I'm not actively choosing to feel abandonment. Am I somewhere there, or?
In a sense, you're not responsible for the past, but you are responsible for the present. So this technique actually teaches you that the situation's not the issue here.
Okay.
So if your partner says something negative about you and you explode and say, it's his fault, that's why I threw the plate at him. No, that's not true. Okay, we react directly to our body sensations, not to the situation. The situation is only a trigger for our thoughts. And because we have certain particular thoughts that have underlying meaning or power, that co-emerges with these body sensations that we react to. So as you progress with the mindfulness techniques, what you start to be aware of is that I'm responsible for my own experiences. What that person said to me, he's not responsible how I feel. Mm-hmm. No, I'm responsible how I feel. It's because of the way I interpreted what he said as to why I feel.
So you're practicing how you interpret what's coming to you, so that if my apologies, I go back to the colleague situation. If the colleagues leave, you know, to get coffee together,
yes,
I'm responsible of how I interpret that, rather than
that's right.
following the old pattern of thought, which would be that they're abandoning me.
Absolutely.
I'm actually replacing they're abandoning me with that's just two colleagues going out to have coffee because they're good friends.
Yes.
It's actually got nothing to do with me.
And what you're also saying is, I don't feel distressed because they've gone out to have coffee. I'm feeling distressed because of what I'm thinking about them just going out for coffee.
It's my thoughts that are distressing me rather than the situation.
Yes. And so we suffer. We all suffer emotionally and mentally because of thoughts. Okay. Mm. And with clients that have past trauma, it's those thoughts that still in the present moment create that suffering. But the mind is reacting to those thoughts as if it's happening in the present moment.
Yeah.
So they're just really living that experience, as you did just now when we were talking. So you're re-experiencing probably stuff from your childhood that's coming up. So we suffer because of our thoughts, and that's so important to realize. And it's because we interpret those thoughts as reality in the present moment, whereas that's not true at all.
Mm. And so part of therapy is really kind of delving deep into that and kind of examining each of the thoughts and looking at, how are you going to interpret the thought, how are you going to interpret the situation, how are you going to respond to it, and potentially how you can even replace it with something that's more adaptive.
Okay, so some treatments will go that route.
Okay.
CBT, some trauma-focused treatments might go that way. And some of the recommendations for complex trauma is that the second phase is to desensitize to memories, specific memories. Mindfulness is very different. We're not interested in the content of the thought. What we're interested in is how the mind processes the thought. Mm-hmm. And what happens is by doing these mindfulness exercises, you are actually committing exposure to those things that are causing you distress, and that's your thoughts and body sensations. So you, by doing these regular practicing that I encourage my clients to do, are desensitizing to these internal exposures. And we're not focusing on the content. We never focus on content. It's how is the mind processing information, and how can we change the way that mind is processing the information. So with CBT, you would focus on the specific content of the thought. With MICBT, we're not interested in content.
Because you're doing the mindfulness work with the thought, not necessarily questioning the thought, but looking at how do I process it.
That's
and so
right.
if I can be mindful and hold a grounded position while I have that thought, I'm processing that thought differently than I was previously.
You are?
Yes, it's an active practice
It's
to expose you to it so it has less of an impact.
Yeah, so it's an active practice in that you're taking, say, half an hour in the morning, half an hour in the evening to do these exercises, which are training the mind to let the thought go. Mm-hmm. So what's happening is your mind processes information in the sense that it sees the thought as reality, okay? And so what it does, it holds on to the thought and your amygdala fires up and you get ready to fight this danger, which isn't there. Mm-hmm. So by doing regular practice, you're training your mind to see a thought for what it is, just a thought. And so it learns to let it go. That's where the process is taking change. It's learning to let the thought go and to see a thought for what it is, not reality. Mm. And that generalizes to all thoughts, not just to specific thoughts, okay? It becomes harder when these thoughts are, the underlying power is deeply entrenched, powerful schemas. And that's then where I introduce schema therapy to develop awareness to why sometimes certain thoughts and body sensations take a longer time to develop acceptance to. You still use the same techniques. It's just because they're so powerfully entrenched and they can be so intense that it just takes longer for the mind to develop acceptance to those internal experiences, thoughts and body sensations. Mm. So that's, in that way, it's very different to your normal CBT techniques and similar techniques. Yeah.
And from your experience, how long would you say someone needs to practice these? If someone's fairly motivated and you're able to identify some of those schemas, the trauma, in a if we kind of say a reasonably moderate to severe sort of presentation, how long would it take? And I know there's it's a how long's a piece of string question,
That's right.
but if from your experience, what would you say?
My experience is it depends how much effort they put into their practice and time. So it's about making time and effort. If they practice regularly as prescribed, throughout the day, whenever it's required, what I notice, they'll start to notice symptom reduction within 5 to 10 weeks. Okay, the problems aren't resolved, but then starting to they should, after 5 sessions, be able to start regulating their emotions. Not to very powerful schemas, but to a lot of the more or less powerful thoughts and body sensations, intense body sensations, they'll start to notice the difference. So by session 5, the belief that, okay, this is working starts to kick in. They're starting to take control. They can feel that sense of self-control. That's important before we move into the next stages. So they're already starting to notice. Okay, but when you've got somebody like borderline personality disorder with a lot of powerful schemas, for example, treatment, if you start integrating the MICBT with the schema therapy, we're talking like a year, because usually it's because they're struggling to engage in the treatment.
Sure.
It's got a lot to do with that. But for a lot of my clients, if they are engaging, they start to notice changes after about 5 sessions, okay, which depending on whether we do it fortnightly or weekly, 5 to 10 weeks. I'm not saying they're cured. I'm just saying they're starting to notice the changes and they're starting to get the sense of control. They're starting to observe emotional regulation.
Brings back hope again, that I can live differently.
Yeah. And so that gives them a motivation to continue. But I have to bring in the schema therapy because it's that cognitive restructuring and reframing. It's helping them to be aware that there's certain body sensations that they're struggling to accept along with the thoughts, and that it's a schema. So I teach them when to identify when a schema gets triggered. And that cognitive awareness that a schema has been triggered just gives them enough little gap between them and their experience that they can then put in a technique or a strategy or tool that I've taught them to then manage that experience.
Absolutely, there's a big difference that you can see in someone going out and inflicting or stepping towards pain, versus pain being inflicted on them. So it's much easier. I think there was a famous study, and I can't recall exactly in my mind, but someone was asked, was forced to put their hand in an ice bucket. and
Yes.
the hand was held in there until they said I can't handle it anymore, and they pull it out and they time how long that would take. And then the second, instruction afterwards, after the hand had at rest, was put your hand in the ice bucket and see how long you can hold it in for. And invariably, those who are given the instruction that you can put your hand in, and see how long you can bear it for, versus those given the instruction of I'm going to hold your hand in there, the ones that had control over it could last longer. So
Yes.
the perceived or the experienced pain was less when you have control. So
Yep.
by someone seeing or being able to identify when they're likely to be triggered, they can kind of step into it rather than it kind of, sideswipes them.
Absolutely. So they perceive that there's a bit of sense of control because they can understand what's going on. Okay, a schema's been triggered.
Yes.
Or a mode. I won't go into that now, but a schema's been triggered. This is my defect of a schema. It's not mine, it's the defect of a schema.
Yes.
And so it just gives them a sense of control. And now they can get a little break, put into practice some skills, and get through that little period of difficulty. And the more they do that, then it weakens the schema.
Yeah, fantastic.
Because the schema, we know the schema has been triggered just because of thoughts and body sensations. So if you stop feeding them, in other words, you stop reacting to them, they start to get weaker.
Yeah. Wow. Fascinating stuff, Richard. I think we could talk for a week straight.
Absolutely.
For those listening, have you got any suggestions of a good book that around trauma or the MICBT approach that people could read further on if they're interested in?
There is a book on complex trauma.
Yes.
There's a couple out there, but the one I know of is by Trudy Curran, I think it is, or Morin, and I think it's Steven Stoffelen. They're two people from the Netherlands. They've put a book together on complex trauma. Like I say, these books can be. There's nothing specific. It's just a lot of information about what the symptoms could be, what various options you have for treatment, etc., etc. I mean, like I say, it's such a complex disorder that there's a lot out there. But that's a book that I would probably recommend for complex trauma.
That's
a very
what I
good
think,
book.
That's what I think is so interesting about trauma, and I like the idea of looking at trauma as not a category, but rather as a process, as an experience.
Yes.
You and I were not born categories.
Absolutely.
So we didn't have a category that was attached to
Yeah.
us, and to now go out and categorize doesn't give justice to the human experience. And
No,
I
it
think if we
doesn't.
can read
Yeah.
about something that gives us more process-based stuff, I think it's much more powerful
Yes.
than putting a bunch of labels and characteristic traits. So that sounds like a fantastic read. So can you give me the authors again?
It's
Sarah?
Trudy Morin.
Yes.
And I think it's Michael Stoffelen, Stofflen.
We'll make sure that we have a link to
complex
those.
trauma. I just can't remember the exact title, but it starts with a complex trauma.
I'm sure everyone will be able to Google it. So,
yes.
Yeah, fantastic. Very much appreciated, Richard, for coming on and talking about your amazing experience with complex trauma. And I think I've certainly got a lot out of that, and I'm sure everyone else has as well. So thanks again, and we'll have to have you back on at some point.
Pleasure. My pleasure. Look forward to it. Thanks, Nesh.
Thanks, Richard.